list of medications that you're allowed to take, and it's a lot cheaper than the expensive ones. And first, you'd have to try those out first before you move on to the expensive medicines, because they don't want to waste the valuable medicine. Married couples also get benefits from insurance. Lessons I learned. So Dr. Tammy taught me to always take my time with my patients. She stays late almost every day, like 2 hours later than her actual shift. And that's what patients love about her. She's also a psychologist. In order to get to know the patient and to diagnose them and help them out with medication and stuff, she would need to know their daily routine, things that they do every day. Like if a patient had COPD, she would need to know, are they a smoker? Do they follow someone who's a smoker? Or are they around like secondhand smoke constantly? Rashes, strokes, she would need to know where you work at. Are you working in the heat, outside, outdoors? Does that require specific medication? Like, would that cause side effects? Doctors also work in like loops type of thing. They refer each other, they refer their patients to the doctors that they know of. So within this loop, they would have internal medicine family doctor, a nephrologist, a cardiologist, all these different specialty doctors within it. These are what the common medications I've seen Dr. Tammy prescribe for most of these complications that patients have had. Like Adderall would be for attention deficit, lisinopril would be for high blood pressure, metformin is for diabetes, Z-Pak is for a cough, fish oil is for cholesterol, but that's not really prescribed. Now for the research part. Does sleep apnea affect each individual's mental and physical health by increasing their chances of developing a common disease such as diabetes, high blood pressure, and or memory loss? So what I needed to research was, how does sleep apnea, which is basically an interruption in your breathing while you sleep, how does that affect your chances of getting, how does that affect your mental and physical health? So just a little broad background. Typically, a normal person would have a blood pressure of 90 over 60 to 120 over 80. If the top number is a little higher, then that's a problem, but that's about average. Glucose would be 70 to 100 milligrams per deciliter, and then memory capacity would just be, in general, being able to remember things and detect or recall certain experiences that you've been through. Introduction. So infants are recommended to sleep around 20 days a day, 20 hours a day, and I mean that's 24 hours a day, so 20 hours a day would be almost the entire day. But because they take it in increments of like about 2 hours or so, it's kind of spaced out. But a lot of people would misunderstand that, like the parents, how would they adjust to their baby's timing as insomnia? I mean, as sleep apnea. They would think that sleep apnea is more sleep interruptions due to anything. But sleep apnea is specific to something that's blocking your air pathway. And so it's just a common misconception that everyone thinks that sleep apnea is the same thing as insomnia, but it's not. So insomnia could be a number of different things that interrupt your sleep, like colic, distress, depression, anxiety, nightmares, anything like that. Amongst that could be sleep apnea. So sleep apnea could cause insomnia, but insomnia and sleep apnea are completely two different problems or complications. So sleep apnea is the interruption of oxygen, anything that can be clogging your airway while you sleep, and unconsciously you won't notice it because you're sleeping. So most people would just assume they don't have anything and snoring is normal, but in fact they're not getting it there. So my assumption or my hypothesis would be that sleep apnea does affect your memory, your diabetes, and high blood pressure. Here's a diagram of like the tongue, the hard plate, soft plate, and how when obstructive sleep apnea would kind of block that area where you breathe. And if you were to apply like an oral device or a CPAP, which is like oxygen blowing down, oxygen that goes down your neck, that could help keep the airway open while you're sleeping. So facts and statistics. 18 million Americans are thought to have sleep apnea, but only 10 million have symptoms. 0.6 million have been diagnosed. So a lot of people don't go to the doctor because they think it's completely normal if I'm tired during the day. Men are twice as likely. The causes could be anything from allergies that are clogging up your nose and you can't breathe while you're sleeping, or to taking tranquilizers, which kind of relax the neck muscles, and that would kind of block the airway because your muscles are blocking your blocking the air from getting to the rest of your body. It's also a family disorder. It passes on. So there are two kinds. Obstructive sleep apnea is anything that is blocking your passageway, while central sleep apnea is the brain itself cannot, or it does not tell the rest of your body to breathe. It just forgets to. It shuts down completely while you're sleeping. A mixed sleep apnea would be both of them, which is pretty severe. Symptoms. Most people feel tired, fatigued most of the day. They lose concentration, a little bit of impairment. They might faint. They might feel more anxiety and on edge most of the time because they don't get enough sleep. Sepsis diagnosis. If you think that you have sleep apnea, you would need to go to a doctor, and by going to a doctor, they'll ask you a bunch of questionnaires. You'll fill out a sleep study, and you'll do a polysomnography study, which basically checks the oxygen levels in your blood. It checks your high blood pressure, overall your entire system, to make sure, or to detect how much oxygen is going through your system. That's what I just talked about. So layout. Here's what I'm going to show you my research and the data that I found. First, I broke it up into 3 studies. The first study would be how sleep apnea impacts diabetes in the AHEAD study, then how it would impact high blood pressure in the John Hopkins study, and memory loss in the NYU sleep disorders. So within the sleep AHEAD study, they wanted to prove how diabetes is affected through sleep, from sleep apnea. What this doctor did was he took 306 obese patients with stage 2 diabetes. 80% of them were had sleep apnea, so a good percentage of them did have it. And then some of these, after they were put through the polysomnography study, a lot of them got little to no air at all while they were sleeping, possibly because of obesity and because of diabetes. And so what caused this was when you're sleeping and your body isn't getting enough oxygen, your body tends to release a bunch of hormones to adjust your insulin levels, and that would actually throw it off instead, and that increases diabetes. So it puts your body into a fight or flight mood, releasing stress hormones that can raise high blood glucose levels. So when you're sleepy, you normally wouldn't want to walk, or you would tend to snack more, increasing your risk of diabetes as well. So within this study, this one is apnea affects high blood pressure. And this doctor took 6,000 adults, men and women, and he used a polysomnography study during the evening times on men. He went to their homes and he checked up on them daily. And he realized that those with 30 pauses per an hour are more likely to suffer from high blood pressure than those without breathing pauses. So he noticed that those with sleep apnea who kept getting interrupted in their sleep, that actually increased their risk of getting high blood pressure. And even though he made sure there was no other variable interrupting the data, he made sure the patients stayed the same weight. They did not change their waist circumferences, did not change, so that obesity wouldn't have a factor in this, and that just shows how high blood pressure directly is linked to sleep apnea. In this study, this shows how high blood pressure, how sleep apnea eventually leads to a stroke through high blood pressure. This doctor took 1,052 patients who had sleep disorders, put them on a polysomnography, and noticed that they had lower results, which then increased their risk of getting high blood pressure, leading to stroke. This one is my favorite, NYU sleep disorder study, how it affects your memory. So this doctor recruited 18 patients. They stayed 2 nights in the NYU, and they were given all day to just play video games. And as they played video games, they wanted to see their memory. How they play video games, how does that relate to how they remember things in the morning? And they were put through this 3D spatial maze and asked to find their way. So they found that those who were put on for 1 night with the CPAP improved 30% more in the maze, and those who, during their REM sleep, which is the first 90 minutes of your sleep, were taken off of the CPAP, they actually took 4% longer to get through the maze. Here's a link if we have time. I'll put it. So treatment options. Reduction tranquilizers, so that your muscles are still attentive and they're able to hold up your head and you can breathe. Simple tactics would include sleeping on one side, raising the head of the bed, opening nasal passages, holding your tongue in place because your tongue may actually clog up the airway. Surgical procedures like the UPPP, which actually it's putting, it's a surgical procedure that requires your, that keeps your airway open while you're asleep, and most commonly is a CPAP, where it's like oxygen being blown down your chest, or down your neck, so that the airway is still open. These are some other statistics. So 23 million of Americans suffer from type 2 diabetes, and 70% of those have sleep apnea, while 60 million of Americans suffer from high blood pressure, and 30 to 40% of those have sleep apnea. This picture shows how your brain memory is damaged through your lack of sleep, which is the hippocampus. Conclusion. This may increase one's chance in getting high blood pressure, diabetes, memory loss, because lack of sleep makes you fatigued and completely lost most of the time, confused, you forget, and so sleep apnea